I'm Dr. Zakas, and I specialize in regenerative orthopedics. That is the specialty of healing your body and helping you prevent surgery using your body's own cells. Today, I'm going to be talking about multiple different types of injections for knee osteoarthritis pain. The first type of injection is a simple cortisone injection. And what cortisone is are multiple different formulations of medications that are similar to cortisol, one of your body's own anti-inflammatories. Cortisone injections come in many different brand names such as Kenalog, dexamethasone, and Depomedrol. And when injected into a knee, it can give significant pain relief for a few weeks at a time. There's also a long-acting preparation of a steroid now called Zilretta, and this medication can give relief for up to 3 months at a time. So when you go and you see a primary care doctor or a sports medicine doctor or orthopedic surgeon and you tell them that your knee hurts, this is the most likely thing they're going to reach for first because it's quick, it's easy, it's off the shelf, the injection takes a couple of moments, and generally patients are very happy because their knee feels better within a few days. Unfortunately, there are multiple research studies that show that in a dose-dependent manner, cortisone actually damages the existing cartilage you have in your knee. So if you take patients and you inject them with cortisone every 3 months for 2 years, and then you MRI their knees versus a saline injection, the people that got the cortisone are going to have significantly decreased cartilage in their knee. And the faster you lose cartilage in your knee, the faster you're on your way to needing a knee replacement. So the pros of a cortisone injection are that it's cheap, easy, and quick, and that you get relief within days. The cons of this, however, are that with repeated administration, it will make your underlying condition worse if you have osteoarthritis. The second type of injection for knee osteoarthritis is platelet-rich plasma injections. And what platelet-rich plasma is a process where blood is taken out of your arm, it's spun down in a centrifuge to get a high concentration of your platelets. Your platelets are like the first responders of healing in your body. So when you get a cut, the platelets go to the cut first, they seal it up, and then they secrete growth factors and other cytokines, which attract other cells to come to the area to heal. So what platelet-rich plasma can do in knee osteoarthritis is it can significantly decrease inflammation in the knee. It can change that chemical profile from a pro-inflammatory profile to an anti-inflammatory chemical profile. And platelet-rich plasma, or PRP, can be injected just into the joint itself in knee osteoarthritis, but can also be injected into the ligaments and tendons of the joint as well. And when PRP is injected into those structures, it can actually affect healing of those structures. Now, when you're looking to get a platelet-rich plasma injection for knee osteoarthritis, it's vitally important that you find a doctor who knows how to process this the right way. I have many patients who go to other doctors and they only draw 1 or 2 tubes of blood. That's simply not enough volume to get the platelets that you need. You have to think of knee PRP injections as like a dose, like a medication, where you need 10 billion platelets. If your doctor is only drawing 1 or 2 tubes of blood, there's no way they'll be able to get that many platelets. You need your doctor to draw about 20 tubes of blood and sometimes even more than that. And that will come out to about 80 to 120 milliliters. That's just to have enough volume of platelets in your sample so that it can then be spun down. And then they have to have a platelet extraction process where they can take a high amount of those platelets and put it into the final platelet-rich plasma product. Platelet-rich plasma is not covered by insurance at this time. So if you're going to spend your cash on a PRP injection, I want you to make sure it is not a lousy low-dose PRP injection, a 1 or 2 tube draw PRP injection. And a high concentration, high dose PRP injection can give relief of osteoarthritis pain for up to a year and sometimes even longer than that. So the pros of PRP for knee osteoarthritis are that it is very effective, it's very safe, it does not damage cartilage, it actually might even help protect the cartilage. The cons are that it's not covered by insurance, and if you go to some doctors, you might get a lousy low-dose PRP injection and end up wasting your money. A third type of knee injection for knee osteoarthritis are what's called gel injections, or more formally, hyaluronic acid injections or viscosupplementation. This is brand names like Hymovis or Orthovisc or Monovisc. And what these injections do is they provide mechanical cushioning to the knee. They almost think of it as like a lubricating effect in the knee. And these knee injections can be very effective at giving people pain relief for up to 6 months at a time. And also, gel injections can be combined with platelet-rich plasma injections. And there is some research that shows that this may work better than just PRP injections alone. Hyaluronic acid injections can be administered in either a formulation of just one injection or somewhere between 2 to 5 injections over several weeks. And the research shows there probably isn't much of a difference between these two dosing schedules. There was one small study that said maybe 2 to 4 weekly injections work better than one, but that was contradicted by other studies which said there is no difference. So I like to tell my patients that there probably isn't any difference. And so we like to use a one-shot technique. And so the pros of viscosupplementation injections are that it can give up to 6 months of relief at a time by itself. It can be combined with platelet-rich plasma to potentially extend the effect of that from a year or even longer. And that unlike cortisone, it does not damage your cartilage, even with repeated administration. The cons are that viscosupplementation does not do anything to change the underlying condition of the knee, and your knee will continue to degenerate when you're taking these injections over and over again. A second downside is that a lot of insurances now are not covering viscosupplementation anymore in the United States. I don't know why. This is a proven treatment that works really well. So unfortunately, a lot of patients do have to pay out of pocket for this now. The next injection type are Prolotherapy injections. And Prolotherapy is an injection of a dextrose-based solution, typically into ligaments and tendons to stimulate healing, but in the case of osteoarthritis, can also be injected into the joint. Prolotherapy has been around since the 1940s or so and has been used in a lot of different capacities for treatment all over the body for all kinds of ligament and tendon conditions. Now, the research for prolotherapy into knee osteoarthritis is kind of mixed because multiple different doctors are using multiple different protocols, and it was hard to really pin down one exact treatment protocol. In general, doctors were injecting all of the different ligaments and the outside of the knee, the medial collateral ligament, the lateral collateral ligament. Sometimes they were aiming for the ACL as well as the patellar tendon and quadricep tendon, and then into the actual joint itself. So prolotherapy injections would stimulate some healing, and the thought was that by stimulating the healing of the structures around the joint, it would better support the joint, and then also putting some of the solution inside the joint itself. Prolotherapy injections are very much the predecessor to our common day platelet-rich plasma injections. The healing and stimulating effect of the dextrose on ligaments and tendons is not nearly as strong as a high concentration platelet-rich plasma. And for this reason, for a treatment like a knee, a patient would have to come in many times, maybe like 4 to 8 treatments over several months to actually start to experience relief. And this is a lot for patients to go through. It would involve multiple visits to the doctor. So the pros of prolotherapy are that it could actually help to stimulate and repair and strengthen the ligaments and tendons around the knee, giving the knee more support. The downside is that it was not covered by insurance, just like platelet-rich plasma is not, and that it would require multiple visits to the doctor and multiple series of injections over months before most patients would start to feel relief. The next type of injection technique for knee osteoarthritis is called genicular nerve radiofrequency ablation, also known as knee RFA. And what knee RFA is a technique where your doctor places under X-ray guidance a needle into multiple different areas of nerves that surround the knee, the genicular nerves, which gives some of the pain sensation to the joint. And then a special probe with a heating tip at the end of that is introduced through those needles. And through a thermal injury, there is a scarring and damaging effect to these nerves. And once those nerves are damaged, that prevents the pain signal from getting from your knee to your brain to tell you that you're having pain. Before the ablation is done, your doctor will typically do a genicular nerve block, which is a test block of lidocaine into these nerves. That gives you a couple hours of time to see whether affecting those nerves will affect your knee pain or not. If it does, then typically your doctor will then go on to the genicular radiofrequency ablation. And the research shows that this technique can give patients from 6 to 24 months of relief at a time. Now, just like when this procedure is done for spine pain, those nerves do grow back. And once those nerves grow back, your pain will come back as well. In my experience with this technique, patients seem to do well with this if they already had a knee replacement and were having some significant pain after the knee replacement, which is not uncommon after that surgery. When I had patients come in and they had severe osteoarthritis or bone-on-bone arthritis, this technique didn't seem to work nearly as well in those cases. And so the pros of genicular nerve radiofrequency ablation are that it can give durable relief of pain from knee osteoarthritis from 6 to 24 months of relief at a time. It also does not damage cartilage in the way that a cortisone injection does. So this is a procedure that can be repeated, and you don't necessarily have to worry about it damaging your joint further. The cons are that, just like with viscosupplementation, a lot of insurances are not covering this procedure anymore. And so you will likely be paying out of pocket for this. Another con is that you do have to have this procedure repeated over and over again. And in my experience, most patients get closer to about the 6 months worth of relief than the year or the 24 months. And so often this does have to be repeated over and over again. And the final type of injection that I'm going to talk about today for knee osteoarthritis is called Arthrosamid. And what Arthrosamid is a medication. It is a polyacrylamide hydrogel that can be injected one time into the knee. From there, it acts as a non-absorbable scaffold, and it actually integrates itself into the synovium of the knee. And the research on Arthrosamid shows that it can give durable pain relief for many years at a time, up to 4 years in one study. And that's pretty impressive compared to a lot of other of these knee injection types. Arthrosamid is a very unique type of injection because it is not really like the other ones because of the way it actually integrates itself into the structure of the knee. And for that reason, it may be used in the future to introduce other products in the knee, such as stem cells or platelet-rich plasma in a combination. But even by itself, Arthrosamid stands up really well compared to these other treatments. So the pros of this are that it is a one-time injection. It can give multiple years, up to 4 years worth of relief at a time, and it does not damage your cartilage. The cons are that it is only available in some places and not available in the United States. It is approved in Canada and also in Europe and the UK, but I've had several patients tell me they can't even find places in Europe that administer this injection. As a regenerative orthopedic specialist, I use platelet-rich plasma the most out of all of these injections. And the reason is because it gives excellent relief, it's very reliable, and it's very safe. Sometimes I do include viscosupplementation with the PRP in certain patients, especially when they have more advanced osteoarthritis. Thank you for watching my video today. And if you enjoyed this video, please like, subscribe, and share.